All right, good afternoon, everyone. It's 2 o'clock. It's time to start the briefing. Thanks for joining us. On today's briefing, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services at the Milwaukee County Office of Emergency Management, and Marlena Jackson, Interim Commissioner of the Milwaukee Health Department. County Executive Crowley, we'll start with you.
Thank you so much, Sydney, and thank you everyone for being here. I want to first acknowledge that yesterday was Indigenous Peoples Day, and it's an opportunity for us all to recognize those who lived on this land first. Wisconsin is the ancestral land of Native nations who first called this place home. It's important to recognize this history and heritage, not just one day out of the year, but to remember that all of the great city and county that has been built is on the lands that have been cultivated long before any of us arrived. Today, Wisconsin is home to 12 Native nations, and we honor that Milwaukee County is the traditional territory of the Menominee, Fox, Mascoutin, Sauk, Potawatomi, Ojibwe, and the Ho-Chunk tribes. It's important to honor all those who came before us and the generations to come who will continue. And one way to protect the rights of generations to come is by voting. And so tomorrow is the deadline to register to vote online. So you can visit myvote.wi.gov in order to register. If you're registering by mail, your application must be postmarked by October 14th. Once you register, you can request your absentee ballot and make sure to fill it out and submit your absentee ballot in person by Election Day, which is Tuesday, November 3rd. If you're mailing in your ballot, be sure to allow enough time for it to make it to your clerk's office by Election Day. I also want to make sure to say that I was extremely pleased to see that the circuit court judge rejected the efforts to overturn the statewide mask mandate that was been put in place by Governor Evers. So I want to encourage people to continue to wear their mask. It's definitely one of the simplest ways to protect others and slow down the spread of COVID-19. And according to the Centers for Disease Control, cloth face coverings can reduce the spread of the disease, particularly when used universally within communities. And mask wearing is particularly critical because Wisconsin COVID numbers are concerning. The state reported a record of 950 people hospitalized with the virus yesterday. And Wisconsin now has 10 of the top 20 metro areas with the highest infection rates throughout the country. Fortunately, Milwaukee County is not included on that list, but our numbers are still too high. So it's important to stay vigilant. Remember the 3 W's, wear a mask or a face covering in public, wash your hands, and please watch your distance. I want to thank all Milwaukee County residents and many of our small businesses for making the sacrifices that are so important to keep our entire community safe. With that said, I'd like to turn it over to Mayor Barrett.
Thank you very much, Mr. County Executive, and thank you for your partnership in these difficult times. Good afternoon, everyone. I want to start out by talking about the different sites that we have in operation right now, because this is new and this is a period of transition between where we've been and with the National Guard next week starting to ramp down. I think it's important for people to have an understanding of exactly where we are. But this is the week of the overlap. And when I say the overlap, I mean, on Monday, we started our 2 new sites at the Northwest Health Center and at the Southside Health Center. In addition to that, this week through Saturday, UMOS and Custer will continue to operate. So our community testing site numbers as of yesterday were really, really solid. At UMOS, we had 1,469. So clearly there's a lot of demand for testing on the south side. At Custer, Obama on the north side, we had 665. On the Northwest Health Center, one of the new sites that just opened yesterday, we had 192 individuals. And at the Southside Health Center, we had 271 individuals. So all 4 centers combined, we had 2,597, which is a very, very healthy amount. We certainly had an outstanding day for testing. And I want to continue to see our community testing sites report such high testing numbers. I think that's a solid sign of people taking this very, very seriously. I also want to know, if they're interested, that our Milwaukee Health Department is now hiring for our test sites. Yesterday, we began, as I said, our COVID-19 drive-through testing at both our Northwest and Southside Health Centers. The hours for these testing sites are going to be Monday, Tuesday, Thursday, and Friday from 9 a.m. to 3 p.m. and Wednesday from 10 a.m. to 6 p.m. This is all subject to change, of course, but this is what we're starting with. Our Miller Park Community Testing site opens October 19th, which is Monday, and will operate Monday to Friday, 11 a.m. to 6 p.m. The Milwaukee Health Department is seeking individuals for all three of these community testing sites. Both part-time and full-time positions are available for registration assistants, for testers, and for runners. So there's a wide range of opportunities for individuals, and training and orientation will be provided on site. So please look at our website for the health department or contact our health department if you're interested. Again, what we're looking for is we're looking for registration assistants, we're looking for testers, we're looking for runners. So this is not something where you need to have a PhD in something. These are opportunities for you to have a job where you can help support your family. I also want to talk a little bit about the update of our Restart Grant Program. This is the program that we instituted using the federal CARES dollars to help small businesses who have been hurt by the pandemic and the economic turndown that we have seen. Small businesses that applied up by the closing date, which was last week, are eligible for up to a maximum of $25,000. The Department of City Development is hoping to get an additional $10 million to local businesses with 20 or fewer employees and annual sales of $2 million or less. And as I said, we're fortunate because we've got the federal CARES Act dollars that we're going to be able to use to deal with this. The grants are for COVID-19 related expenses, such as personal protective equipment, restocking of perishable inventory, and physical improvements to reduce the COVID-19 spread. Additionally, and this is important because as it gets colder, I think more and more restaurants in particular are going to look for ways to continue to operate. Grantees can now use the money for some rent and utility payments, as well as for winterizing outdoor spaces. Our goal is pretty clear. It's to offer a lifeline to small businesses to protect jobs, because we know there are a lot of individuals who are dependent upon these businesses for their jobs, and to obviously to retain and improve neighborhood vitality. And because the focus is on Milwaukee small businesses, it appears the majority of grants will go to minority-owned businesses. And that's exactly what we're seeing. The second round of applications are currently under review, and so far, 967 completed applications have been submitted, and 142 have been initially approved. We're doing this very quickly, so you should be hearing pretty soon. Our initial numbers show that 54% of applicants reported as minority-owned businesses, and 46% of applicants reported as women-owned businesses. Our hope, again, is to get the bulk of the grants to the approved recipients by the end of the month, by the end of October. Finally, I want to send a word of caution out, because what we are seeing, and Dr. Weston will talk about this, I'm sure, is we're starting to see an increase in numbers. This is something that I monitor on a daily basis, sometimes several times a day, looking at the different reporting sites. And we've been very, very clear that if we continue to see numbers going in the right direction, we are going to be forced to take additional steps. What I have seen is I have seen generally, and I use that word, generally good compliance from restaurants in complying with the agreement that we have with them. We have not seen as good a compliance in the bars. And if the bars want to screw this up, then there's going to be problems. And so I want to see the bars follow these rules. And you can ruin it for yourself, and you can ruin it for everybody else if you don't take this seriously. So that's a word to the wise, that we are looking at the numbers, we're concerned. Again, I think the vast majority of restaurants have been very, very appropriate and worked with us, but we're starting to see concerns in the bars, and we're looking at that very, very carefully. So with that, I'm going to turn it over to Dr. Weston to have an update on the numbers for today. Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. First to our numbers, we've had 32,943 confirmed cases of COVID-19 in our community, and 444 individuals who died. We are now only to Tuesday, and it's been quite a week already. As the mayor mentioned, our cases and hospitalizations in the state and now in the county continue to rise. We've now seen a near tripling in COVID hospitalizations in Milwaukee County in about as many weeks. And at the state level, we're seeing a continued spike in hospitalizations now as we prepare to open the alternate care facility tomorrow. On top of that, we're transitioning our testing strategy. We opened the 2 new Milwaukee Health Department testing sites on the Northwest and the South Side, seeing pretty large volumes of patients at each of those. And we're preparing for next week's transition from the current National Guard testing sites at Umos and Custer to the Miller Park testing site. And this is all in the setting of the governor's recent order cutting capacity in many indoor settings. So there's currently a lot of moving parts in the COVID effort. And those moving parts are appropriate given the crisis that we're facing in our state. And to be clear, we are in a crisis. But in addition to these changes to patient care and to testing, we need to see changes in individual behaviors. There are many people in our community, to be sure, and in our state who are physically distancing and are wearing a mask and are thoughtful about their activity. But for those who are not, please take account of what's happening in our community, what's happening around you. Whether you believe the numbers or perhaps, and I would argue incorrectly, feel that they're inaccurate, the trends are very real and the trends are very bad. Hospitals in the state are feeling so overwhelmed in some cases that they're transferring out patients. And you better believe that is not a decision those hospitals reach lightly. All this is to say that policies and orders do not work in isolation. They require individual decision-making. So help us to bring Wisconsin out of the crisis that we're in. Help to prevent the inadvertent spread of this disease to your neighbors, your friends, your families. Please wear a mask, wash your hands, watch your distance. These simple steps are critical in the coming days and the coming weeks to ensure the health and safety of our community in the coming months. Finally, I want to once again encourage those with symptoms of COVID-19, those with a close contact who tested positive, or those referred by a healthcare or public health practitioner to please get tested and isolate after your test until you receive your test result. In addition to our large community testing sites, remember we also have in Milwaukee County 16 additional healthcare and community health center testing sites, and those can be found by calling 211 or visiting testupmke.com. Thank you, stay safe, and I'll pass it along to Commissioner Jackson.
Thank you, Dr. Weston. So first, I want to just take an opportunity to publicly thank the team that has been working on our transition of our COVID testing 19 sites. So Dr. Nick Tamaro and Celia O'Shaughnessy and their team, Dr. Weston and his team, as well as Dr. Heather Parity from the Milwaukee Health Department. This group has worked tirelessly to get our sites up and running. And as the mayor has already shared, we have received our first patients in our first test group that have been tested. And we're thankful for the work to get that up and running. We're optimistic that as we move forward, those numbers will continue to increase and we'll continue to be able to meet the need for servicing our COVID testing sites. So with that, I'm going to transition and I'm going to talk a little bit today about the flu vaccine. So flu or influenza, as well as COVID-19, are both contagious respiratory illnesses, but they're caused by different viruses. Getting the flu vaccine or the flu shot is going to be essential this year in reducing our overall population impact as it relates to those respiratory illnesses, and also will be key to helping us to keep those healthcare numbers and those hospitalization numbers down. As Dr. Weston has already shared, as a county as well as a state, our hospital systems are increasing in their hospitalizations. So anything that we can do to help to decrease that number is something that we should be doing as a community. The flu vaccine is recommended for anyone and everyone over 6 months. And it typically circulates the United States annually and is most common in the late fall through the early spring. Individuals who become ill with flu do recover from without serious complications. However, there are situations that do cause serious illnesses, hospitalizations, and deaths every year, particularly for older adults, very young children, and individuals with chronic medical conditions. To ensure that every resident in the city of Milwaukee has the opportunity to get vaccinated, the City Health Department is offering free flu vaccine clinics starting this Thursday, October 15th, at our two drive-through health clinic sites. And those sites are the same sites where you can go and get your free COVID testing. Just as a reminder, that's Northwest Health Center, which is located at 7630 West Mill Road, as well as the Southside Health Center, which is 1639 South 23rd Street. The flu vaccination clinics are going to be open Monday, Tuesday, Thursdays, and Fridays from 9 a.m. until 3 o'clock. The flu vaccine is free. There's no appointment necessary. And as a reminder, you can walk up or drive up. So please know that this is a space where you can get your flu vaccine, where you can get tested for COVID-19 all in one shop. So we're doing our best as a city and as a health department to provide these services to you as much as we can and as frequently as we can and as most convenient as possible. So as a reminder, wear your masks, wash your hands, and remember to physically distance. And I thank you for your commitment to fighting this disease and to keeping each other safe. Thanks so much.
Thank you, Commissioner Jackson. Our first question is from Matt Smith at WISN 12, and Matt is going to ask his question on camera.
Hi there, Mayor. This is for you, and Commissioner Jackson can jump in as well. Wanted to talk about the city's plan and the governor's 25% capacity. The governor indicated to us a few days ago he disagrees with the city's position on this and may challenge it. Mayor, curious where the conversations sit today with the governor's office, and are you still firm in your commitment that the city's plan will work under the governor's order?
Well, we've had conversations with the governor's staff several times over the last week. As the way this transpired, when the order first came out, the commissioner, the health commissioner, as well as the city attorney's office, felt that our plan was more restrictive than the state's plan. I said we should contact the governor and the state and let them know that that's what the conclusion was. It was drawn here, so that we've been working very well together, and I want to continue to work well together. So I wanted to make sure that they understood that. They disagreed. We feel very confident that the quality aspects of our plan make it a more restrictive plan. And so we're going to continue to monitor that. But as I said in my earlier remarks, we're also looking at what's going on here. And I think that the restaurants have been very, very productive and proactive in working with us. I do have some concerns with some bars in particular. And so if anything were to cause us to make a change, it would be the behavior we're seeing in bars, both among patrons and employees. But I think where I feel confident is that I think that the city of Milwaukee, as well as the governor and the governor's administration, are headed in the right direction. In other words, we understand the severity of this. This is something that I have personally spent hundreds, if not thousands of hours on. I know the commissioner has feels very strongly. So I think everyone here is trying to do the right thing. And as Dr. Weston said, there's nothing here that isn't subject to change. And we've seen many, many, many changes since this first started earlier this year. So we continue to monitor it, and we'll continue to work with the state the best we can.
Thank you, Mayor Barrett. Our next question comes from Meg Jones at the Journal Sentinel. A question for Dr. Weston. Can you give an update on the number of ICU beds or hospital beds that are currently available in Milwaukee County?
Certainly. So our Milwaukee County dashboard has a tab for hospitalization beds. Maybe I'll actually pull that up here. So we can see that we do have capacity, and we're lucky in Milwaukee County. We have large hospital systems. We have large hospitals within those systems. And so we do have a fair number of capacity, more than certainly in the more rural regions of Wisconsin. But you can see here, we have 390 ICU beds being used, a significant capacity, several hundred more ICU beds. And for floor beds, we're at 1,742. And again, substantial capacity, over 1,000 more floor beds. And for ventilators, quite substantial capacity as well. So I think we are in as good a place as we can be in Milwaukee County, given the circumstances. And a lot of that is because of the planning our hospital systems did way back in February and March. But certainly the trajectory we're seeing here is concerning. The trajectory we're seeing in Milwaukee County. As long as we have this open, it's not quite as severe as the trajectory we're seeing for the state. But you know, it's a concerning trajectory and we need to keep a close eye on it.
Thanks, Dr. Weston. Our next question is from Mark Stevens at CBS 58 for Mayor Barrett. Mayor Barrett, what specifically are you seeing or reading about issues with the bars?
This is just anecdotal. I go around the city and I've looked in some of the bars and I've been disturbed at what I see. And I think bar owners should be on notice that if we continue to see non-compliance, it's going to have ramifications, not just for their bar, but potentially for all of their bars in the city of Milwaukee.
Thank you, Mayor Barrett. I'm seeing a couple more questions about the ACF. We are referring those back to the state. Are there any further questions? Please put them into chat. Matt Smith from WISN 12 has one more question.
Yeah, Mayor, and for health officials on the bars, what would that look like? Does that look like going to the state's 25% capacity, shutting down bars? I mean, what are the options at this point?
Matt, we haven't had those conversations yet. And obviously that would be a decision that would be made by the health department. But I'm voicing my concerns because I want us to continue to be a leader in this. And that means that we have to have people that are cooperating. What we have seen, and I'm very pleased by this, is I think we see far more acceptance of the mask order in Milwaukee than in just about any other part of the state. I think people recognize that. And as a result of that, you have seen Milwaukee improve its standing, for lack of a better phrase, among the counties in the state, particularly in the last several weeks. I don't want to see that slip. I don't want to see that reversed. And so I'm continuing to watch that very, very closely. And our compliance is basically based on our health department. We don't use our police for this. And so again, this is a conversation that we would have with the health department. I don't know if there's anything you want to add, Commissioner, but again, that's the concern that I have.
Yeah, so I would just add that typically what our process has been is when we are notified or if we are apprised of information based off of our routine site visits that there is non-compliance, our first intervention is that we use it as an opportunity to educate. So we make sure that whatever plan they have in place that they're following, we make sure that they understand what the whatever limits we have in place are in process. After that, if we continue to have issues with non-compliance, we are able to issue citations, as well as we are able to, in fact, remove the approval for the safety plan, which means we would be able to move back capacity to the governor's limits. So that is a possibility. And then lastly, our last result is that we can also report back to the licensing board. Obviously, that is our last step, and we want all these other steps to have happened first. So we give people an opportunity and we give organizations an opportunity to correct their issues, to fix it. And if not, then we have to move to more extreme measures.
And to that, just real quick, Dr. Weston, as a final follow-up, just on the overall statewide 25% capacity, do you think that will help in terms of numbers you're seeing? And are you comfortable with the city's position as opposed to the rest of Milwaukee County in terms of how this all plays out over the next couple of days and weeks?
So I think the capacity orders you're seeing, whether it's the state or the city, I'm very hopeful they will help. I think, we know this is spread person to person. The more people that are in a small area, especially in indoor areas, the more spread there can be. So the number of people is key, but also the other measures that are in place, whether it's distancing, whether it's, basic hygiene type measures, they're all going to be essential.
Thank you.
Our next question is from Sari Lusk at the Milwaukee Business Journal, again on the topic of bars. For Mayor Barrett, based on what you're seeing with bars, how do you feel about handling compliance based off complaints?
That's the process we've used thus far. And I think that you also have a team that does monitor it. So it is heavily based on complaints, but we do have the capacity to have our teams go in there. Again, we are not using a heavy law enforcement model here. We're using an education model. And if we don't think that that's adequate, we will change it. But as of right now, I think we're going to continue the course we've taken up to this point.
Our next question is from Mark Stevens at CBS 58. Are the city testing sites going to be open on Saturday? I believe that he's referring to the health department sites.
Commissioner?
So as of right now, our sites are only open Monday, Tuesday, Wednesday, Thursday, and Friday, but we are working to get those weekend sites open. It was a matter of getting up and established first and making sure that we had the staff, as Mayor Barrett already shared. We are working really hard to get the right people in place so that we can operationalize our overall operation. So so the plan is that we will have weekend hours, and once we get that solidified, we'll make sure to share that.
And this is a logistic concern. And what's happening here is at the local level where we deliver the services, it really is, as the commissioner said, getting the operations up and running, getting them staffed up. And we felt that starting with the normal business hours that we have is the best way to start. But we're certainly interested in meeting the needs of the community. But again, operationally, we have to get them up and running before we do anything else.
I believe that that was our final question. We'll give it another minute. All right, thanks everyone for joining us today. That's all of our questions from the media. We will be back again on Thursday. Thanks for your time.
Thank you very much.
Thank you.